Dr. John here, and I want to talk to you about headaches in children. Too often we think that headaches are just something that adults suffer with because of stress of living. However, children, they're exposed to very similar stresses that adults are. Something that we all encounter is the birth process. That can be one of the more stressful things with a lot of pressure and stress on the head, neck area. That can predispose a child to having misalignments and stress to the nerve system, structures of the neck, including the muscles in and around the head and neck area. So as they continue to age and develop, they might start complaining of headaches, but not realizing that it could be tied back to the birth process itself. Also, just learning to crawl, learning to walk, starting to play sports, being very active. Children fall thousands of times, and some of those falls can cause spinal bones to misalign. They can create a whiplash-like injury to the head and neck, and that can cause muscle tension, nerve irritation, and also be the cause of a headache. We see more and more athletes, our youth, are suffering more and more concussions, and that's causing a jarring of the skull and neck area. Headaches, migraines are very commonly a result of those injuries, and we do a great job of addressing the cause, making sure that there's proper alignment to the spine, making sure that the muscles and soft tissues are healing properly, and for infants and toddlers even, a specialty in checking and evaluating their spines and nerve systems to make sure that they're growing, developing properly without stress on the nerve system due to, like I said, any traumatic or stressful birth or early injuries, so that they're growing and developing properly. We also need to consider their diet. Children are smaller adults. They need adequate food and nutrient intake. They need to be properly hydrated. So minimizing white foods, especially sugar, processed foods, and making sure that they're properly hydrated, drinking enough water is important as well. So if your child or a child you know complains of headaches or migraines, it's very important to get them checked. Instead of starting them on a pathway of just taking medications that could carry throughout life, we want to address the cause, not make them dependent on a medication, but rather find a natural way to address the cause of a headache or migraine. So we look forward to seeing you, helping you soon. Don't hesitate to contact us if there's anything we can do to help out.